Good morning, everyone, and welcome to another episode with Coffee with Chris, and where we utilize this platform to provide as much legal and healthcare advocacy information as possible to our audience. Today, I'm excited to have on Susan Ansberry. She's the Community Relations Director for Cambridge Healthcare Center. Welcome, Susan.
Thank you so much, Chris, for having me.
Absolutely. Good to see you.
Thank you.
So certainly we are in some very trying times right now, especially for those populations that we represent, the senior population. So I want to get your perspective on some things that are happening now, what you've seen in the industry, how you see things moving forward, some things that maybe Cambridge is doing as well. But I wanted to get your take on some of that. So I'm sure there's been a lot of changes in your community and a lot of the other senior care communities in general. So can you shed some light on some of these changes and their impact on everyday life for the residents and your staff as well?
Sure, I'd love to. So in our community, we are Cambridge, we are skilled nursing, assisted living, and we also have dementia support. So certainly there are protocols and procedures that have always been in place for our industry and our building. With COVID impacting us, so we were a newly acquired community going through all of those changes, number one, and getting through all of that minutia, and then COVID hit. So the policies, practices, guidelines, CDC, Department of Health, certainly all play a factor in that. And it has meant that we have had to take extra steps for precautionary measures in staff training, how we accept a resident, what those protocols and procedures are within the guidelines of the state of New Jersey. So it's meant extra staffing for us, extra training for us, PPE education beyond belief, because there's a difference when you have a resident that is COVID positive and you're caring for that resident versus a resident that is not COVID positive in a different wing. How do we keep the virus from spreading? How is air movement through the ventilation systems? I mean, it's all been addressed and looked at. So even how we accept residents into the community, even if you come to us from a hospital setting where you were tested in a rapid test and we know you're negative, it doesn't matter. When you come into our location or any skilled nursing location, you're put into an observation area for 2 weeks. Tested at the end of the 2 weeks, you need 2 negatives to then move to, if you continue to be, if you're positive, to a positive wing or a negative wing. So there's a constant shuffling, and that's fine. And we're following those procedures, but what does that mean to the mental ability of the resident who's here? It's unsettling when you're moved so many times. So there's that, we're looking for changes in mental status. It's a lot to take in, but if you follow guidelines, it's going to work.
It is. It sounds like you guys have put a lot in place to make sure that everyone is safe.
Correct.
So with we're now preparing for stage 2 in New Jersey with the reopening, the slow reopening. How does that affect our senior living communities and the families? And how are the communities preparing for stage 3? And what does that look like for you?
So for us, it's been, as it is across the board, a no visitor policy. So then how can we allow our residents to communicate with their friends and family members? So we have put together an elaborate scheduling of time for FaceTiming. So we have a lot of iPads that are floating around. Our activities or programming staff that's a big part of their duties, because residents really aren't allowed to leave their rooms of observation, COVID positive or COVID negative, to make sure that we're containing this virus the best that we can. And evidently, from what we've been told, we're doing a great job at it, but it's a lot of work. It's a lot of extra staff. So that's one thing that we're doing. So we're doing FaceTime, so we have that kind of interaction with family and friends. In assisted living, for example, today, is our opening day on the 16th now of June, where family members can come outside. We have our 6-foot distancing scheduled, seats there, But again, a staff member, and it's going to be like a 30-minute interaction face to face. But a family member can't come and hug that loved one, and they can't do all those normal things. So a staff member has to be there to make sure, because the last thing we want, we are COVID free and we have been in our assisted living, is to have a faulty interaction go into a spread of this horrible disease. So that's the step that we're taking now in stage 2. Moving forward, we're going to grow on those. We can only do what we can do by the guidelines and restrictions within the CDC and the state of New Jersey, Department of Health. So as soon as we're given that opening, we're designing ways to accommodate those interactions and happenings, because it's important for everyone to see their friends and family for their mental status.
That's very important.
But it's tough.
Yeah, and I want to get to the mental component of it in just a minute, but going back to what you said as far as the FaceTiming and that still maintaining that social interaction, that's very important, because we've had some issues in the past with very recently with some of our clients where one was in the hospital and they had zero interaction. They weren't able to FaceTime or anything with the family. So that's a very important component that we'll get to in a minute. And this next question, you may not know exactly, and you mentioned about opening the doors, and congratulations, everyone gets to come over today. But are you familiar with how anyone else is doing this? Because this is the way that you're setting it up. I haven't heard before. So this is very unique, and it sounds like it's very structured. There's still some social interaction there, but it seems like everyone's going to stay safe. So
yes.
How are you going to deal with any potential setbacks? What plans do you have in place for that piece of it, and in lifting the restrictions and socialization?
Sure. So we're all looking forward to that, as any business operation or service industry is. But we're planning for it. I think that's the biggest piece of this. And maybe for us, because we have been full scale 120% in this from when it happened, just because of the nature of our industry. But what that has allowed us to do is to see what's working, what's not working, a better way to build the mousetrap. Being prepared is the best way to go. So I can't believe that it wouldn't translate over to any business function who's going to open their doors to the general public. We're doing it as well. So, my thoughts on this were, that whole fresh eyes theory. You or we may have had family members who walk through that front door 5 times a week to see their mom or dad in long-term care assisted living, right? And they start to walk by, and so do staff members or administration within a building or function that don't see the little tear in the carpet, that don't see the gouge on the wall, that, well, now fresh eyes, when you have someone new who comes in, all of a sudden they're looking at it differently again. They're not just walking by these spaces. I think every business owner should take the time for a fresh eyes theory concept of walking through. And if you're not a good one to do it, then have one of your friends come in who's not familiar with your setting and look, does the exterior of the building look well? How about the landscaping? Are the gutters overflowing? Are there paint chips? Or what does the exterior of the campus look like? What does the interior of the campus look like? Your sign should be fresh and clean. There should be signage just like we do here, and we've always done, and it changes as changes happen. Levels of expectation when you come into my business or property, what you have to do. And it shouldn't be, stop this, you can't do this or this. It should be, welcome back. We're happy to see you again. These are some protocols and procedures that we are going to share in together, including maybe your businesses, you have to wear a mask. Maybe, what age child has to wear a mask? Do you have to social distancing? What does that signage look like? Have you trained your employees and team members and staff on levels of expectation? Or if an emergency happens, are they trained with those next levels of what proper techniques or protocols and procedures need to happen for everyone's safety? That's, I think, how you're going to gain your customers and clients back to a comfortable setting. Empathy with your customers and clients too, I think, is huge. It's not just about all of us who have lost some financial opportunity after running, smoothly for the last so many years business-wise, they've lost their opportunity for a service or a function to be granted to them. So right now we are having a fire drill.
Perfect timing, right?
Linda's going to go see if it's just a fire drill or we have some issues happening. So I apologize
Well,
for that, but
listen, we get to see you in action now.
Yeah, I didn't time that for everyone. But just, my thing is get on the websites. There's a lot of information out there. The Governor Phil Murphy has been very clear with what he wants to happen, when it's going to happen. And if you have questions, go to your local business administration, go to your town and county, look at the state guidelines, and that will guide you through the next steps and process.
So how do you see, moving forward, quote unquote, business as usual? Because, I don't think things are going to be
Nope.
as they were previously for quite some time. So you also mentioned that you're fairly recently under new ownership. So how has that transition been? How do you see business as usual moving forward? And then, what are those safety precautions that are continuing on, and maybe what have you learned from this, and maybe see some improvements moving forward?
Right. It's a great question, and I wish I could answer it with full clarity. As we know, we don't have that. Until we have a vaccine for this virus, it's going to be cautiously moving forward. So in this industry, the way that that's going to look is, literally sometimes daily or weekly changes in protocol and procedure for healthcare guidelines. We had people that we call clinical liaisons who would go into a hospital setting and talk to social workers or case managers or discharge planners about different patients then being released and talking through that in person. That's all changed for now, and we can't see it changing back to normal as far along as we can see. In fact, the hospitals, just for infection and disease control, might say, why have extra people in the hospital when we've been showing that we don't really need that to happen? My husband, went to an office all the time for a big company. They've all been working at home. The business practice has seen, hey, this is working pretty well. You guys stay at home. We're going to close some of those satellite offices. So I think it's going to change a lot for all of us. And I think that's in our own best interest to think ahead as a multi-business owner or a single business owner as to what that might look like and prepare for it. Maybe if you weren't that into computers and technology, that's been our savior through all this, if you think about it. So I can't see that going away. I can only see it getting enhanced moving forward. So I think it's on all of us to look for what those better practices are of best practices and really hone in on them and embrace them.
Yeah, and I think the public in general they're going to need a lot of education moving forward on, because everyone's nervous, everyone's scared of what may happen. Right. And they're going to need a lot of education moving forward because they're still going to need help taking care of mom and dad. And how are you going to do that for them moving forward? So are you providing any education to the public? Are you putting anything out there to let them know what your best practices are and how their loved ones will stay safe?
We do, Chris. It's, because of that disconnection that the state has mandated with coming in person and seeing mom or dad and having eyes on them, we do the FaceTime. So that's one part of it. We also do a daily robocall. So here you go again. There's a technology and there's sites and businesses that have now opened that you can mass produce, a voice message. I think the company is VoiceFriend, to give that information out about where we stand right now as far as the state of New Jersey, if there's any changes in guidelines, and where we stand as a community for our assisted living, our skilled nursing, and dementia support areas, to educate them, to your point about where we stand with our COVID status. Certainly that was a mandate from the state of New Jersey that has to be done. I mean, there's been a lot of negative PR. And you have to overcome that too, you know? So, you know, for a lot of the population, as we all know as business owners, you can have one negative PR stand, for example, in North Jersey at the beginning of this, with that horrendous situation in North Jersey, with a nursing home. And of course, then that goes into everyone's mindset. Oh my God, I can't see my mom. Is that happening? You know, so you try to overcome that. So we do call it a daily press release from the community, but we also talk about things that are happening in the community positive as well. And I think that's, you know, a good way to handle it is good communication. If communication is happening, you're putting people's minds at ease. And then on top of that, having FaceTime calls, minds are at ease. If you stop that just because you can't fit it into your busy schedule, then it's going to get crazy and people are going to start to think outside of the box. The other thing too is the extra staffing that was needed. Certainly you can project what you think is going to be needed until you get into these situations. It's like, well, 2 more people would make that situation better, so we have to do it. Or if you hire, you know, in our industry, as you know, we need to keep certain ratios of staffing. And if the staffing is not there, you need to have an outside agency come in. So now you've just brought someone who might not know exactly your exact protocol and procedure. So now you have to take the time to train them or to oversee part of what they do. So there's all those little puts and takes that you just need to plan ahead and move forward aggressively.
Yeah, it sounds like you guys have put a lot of precautions in place, and from a socialization standpoint, mental standpoint, anxiety standpoint, it sounds like you're keeping the families connected, which is great. Whether it's FaceTiming, you know, Zoom, or as I guess you're doing today, some social interaction outside, so the families can still get together and communicate. I think that's fantastic. Moving forward, what's one piece of advice if you're speaking with someone who is looking to place mom or dad somewhere? What's one piece of advice that you can give them, or what should they be on the lookout for? What's important when someone is searching for a place, especially during these times?
Well, you know, we have moved in. We're averaging like two and a half people, if we can do that, into our assisted living community, even during this COVID situation. It's letting people know that we're COVID-free and assisted living, for example. Knowing that we're following protocols and procedures in our skilled nursing. Having that feeling of comfortable placement with discharge planners and social workers at the hospitals, for example. People are still going to get sick, unfortunately. People are still going to need surgeries and are going to need, you know, subacute rehabs after that, for example. People still have to go somewhere. You know, it's interesting, initially, there's some skilled nursing communities that weren't accepting COVID residents. Well, we're people. We get sick. That's not by their design. They have to go somewhere. So yes, we and some other communities were accepting COVID residents, but what that allowed us to do is to become experts in disease control, because this is what we're faced with. This is how we're going to handle it. And with the state, you know, helping to design these new protocols and procedures or best practices for infection and disease control, we've become the educators now, because we're the ones who know how to do it the best. So I think it's just a comfort in knowing that we're doing what we do well, moving forward, and letting people know that, you know, we're good communicators, and, you know, there's still a value to having, for example, in assisted living, social interaction is huge. You know, mom is still going to be sitting at home doing nothing. That, you know, she'll have that social interaction. Even if right now they have to wear masks, it's still better than sitting at home without a mask with nothing to do, you know?
Right.
And as far as I know right now, Chris, you know, in stage 2, now we can go sit and have a drink after work. And as far as I'm concerned, on the 22nd of June, I can go get my nails done. So stage 2 for me is a big deal.
and priorities, right?
There you go.
So my last question to you, and I'm glad it was just a fire drill, and you guys are safe
Yeah,
over there.
we're good. Thank you.
Right. So with Cambridge Healthcare Center, how do people get in touch with you, or maybe Linda, or someone else at your facility? How do they find you? You have a website, phone number. What's the contact information so that people can reach out to you?
Certainly, they can reach out to myself or Linda. We can put, if we can we put our email addresses on?
Yep, we'll put a link down below.
Yep, that would be great. So Linda Menigan is she's kind of the inside director of community relations, sales and marketing inside. And I was hired actually to be external right in the middle of COVID. So I've been inside doing a lot of various different things, getting to know the building very well and the operations points. So certainly, I mean, we're located on Main Street in Morristown. It was the old Lutheran home. So we're transitioning now to Cambridge, which is a marquee community now under the marquee umbrella. And we're doing great. We're moving forward. We have a $10 million renovation that's going to start, and you know, we're really excited about it.
Yeah, you guys have a fantastic campus, and everyone who has ever been through Morristown knows exactly where you are. It's like a big castle, right? It's beautiful.
Yeah, it is licensed as a castle. Yes. So my funny line is the company that I used to be with, we had a licensed mansion that I was a part of, and you know, so now I've moved on to a castle, and I'm not quite sure what would be after this, but yeah, but it's
Lady Ansberry. There we go.
There you go. I need a tiara though. Yes.
That's right. Thank you, Susan. I really appreciate it. Thank you. Personally, thank you. Thanks to Cambridge for providing so much information and for care in the community. And we'll talk to you soon.
Thank you so much. Love to be a professional partner. Thanks.
Take care. Bye.
Bye-bye. I think we know.